Roll call.
Artis,
Here.
Dawn, Jessica,
Here.
Pam,
Here.
Pete,
Here.
Rod,
Present.
Roger,
Yes.
Ronnalee.
Here.
That we will move on to the approval of the agenda for today. Is there any modifications, changes? Accept it as provided. Been moved and seconded to accept the agenda as provided. All those in favor say aye.
Aye.
All right, citizen comment. Now open for public comment. Anyone in the audience or anyone on Zoom that would like to provide public comment? Now's your up.
There weren't any that signed up online.
We have no public comment. Got some ring. Capturing all the issues. So, yes, I would entertain a motion to either revise or amend the minutes or accept them as provided.
I'll make a motion to accept that as provided.
Second. Okay. Then moved and seconded to accept the minutes as stated in our packet. All those in favor say aye.
Aye.
I'll abstain from that vote just because I wasn't at the meeting.
All right, so the next item on our agenda is we have it as reapers variance or reapers variance. I think Fred, you're gonna present that.
Well, my name is Fred Volker. I'm with the Environmental Health Department. So it's Rikers, Thomas Rikers. The property is that's the Mill Lane, which is in Coram. And the variance is for depth of groundwater. Groundwater was found to be higher than the 48-inch minimum requirement. The 44 inches was the highest it's found. So the engineer, Jeff Schmidt at Pinnacle Environmental Solutions, designed for 44 inches of groundwater, level 2 treatment added to the system as well. There was a secondary variance as well. Elevated sand mound systems have a maximum of 12% slope that they can be constructed on by our regulations. And so they requested a variance because the slopes are in excess of 12%. Average out to be around 17-20%. Based on the Wisconsin sand mound designs, where a lot of the regulations are kind of based off within that area. The reasoning for the 12% maximum was mostly a safety, not so much a functionality of the system. So we believe that the design is adequate and addresses all of the things.
So it's with the recommendation of the health department that we approve the variances that we're requesting.
So yeah, I guess just to add a little more to that with this presentation. The Environmental Health Committee met on Tuesday, and we reviewed this application quite in detail. And the engineer did a good job of designing the sand mound to accommodate this slope also. And the non-degradation passed with flying colors. So it was unanimous concurrence of the Health Department subcommittee to approve both of these variances. We felt it was in line, and they did a great job of processing the application. So with that,
Another thing too is they were going to do level 2 on it as well. So that was,
Another level.
no,
So anyway, the, say that subcommittee unanimously recommended approval of this application, so.
Can you explain the slope thing? In a names.
Ready.
Yeah, so sand mound systems, obviously they're built above ground. The slope, they give a 12% maximum for construction of that. The slopes are again are in excess of that. And in the regulations, in the Wisconsin sand mound designs, which is it's kind of the basis, the design basis for where our regulations derive that 12%. It talks about the 12%. Actually, you can build a mound from 15 to 25%. It's specified in that. Doing so is mostly just a safety concern for getting constructing that sand mound. Typically, what you see is one end of the mound is a tail down, which actually in these soils, which are tight, seem to be tighter soils, it gives more treatment through the sand, which is actually a positive. Again, I think there's always concern that with a slope that you might see some sort of stability issues. But in the Wisconsin sand mound design, nothing like that was cited. And I think, you know engineers and folks in this room, I think we all believe that it's definitely a feasible thing with the design that Jeff submitted. The sand mounds too are actually keyed into the ground a little bit to actually add to the stability.
I understand that's the only part, that's the only issue that is varies is the percentage.
No, that's the depth.
Oh,
Or the areas.
which is why they needed to do that, which is why they needed to do the sand in the first place. And then it had to technically.
So now that we could page down, like page 27 on this thing, there's a diagram that have to locate.
Up this one.
Repeat that, what was that?
Let's see if it'll. There you go. That one.
So that's the design for the sand mount. So I think it's the that is really the gallery of the sand. And it's keyed in like you said up here. Then because it goes this way, it adds a lot more treatment. Sure.
I think it should be noted too, we definitely double checked to make sure there was no more suitable slope on that lot. The entire lot is basically uniform slope. So there was no way to gain anything on the lot.
Thank you. Thank you, Chairman. So with the safety, with the Wisconsin thing, we talked about the safety was the issue with slope. So that's not, it's not physical safety, it's health safety for the treatment safety.
No, sorry, I should clarify, it's actual physical safety. It's like actually safety of constructing the mound itself on a slope like that. That's operating. How do you place that properly?
I guess I was just curious because that seems like it should be more of an approach to the community health issue that's just, sort of out of place there.
And again, that's, just what Jim Wardensky, our manager, must have found when we come back here and look at it. So didn't go into much detail.
Quite interesting. Thank you.
All right. Comments? With a few variances.
I'll make a motion to approve the two variants.
So there's a motion to, the two variances consist of one with variance for the groundwater, which is 48 inches, and the variance for the difference in groundwater for the hill slope. That is your second. Second that. Okay. It moved and seconded to approve the two variances as provided. Janelle, would you do a roll call?
Artis,
Yes.
Don,
Yes.
Jessica. Pam,
Yes.
Pete,
Yes.
Rod,
Yes.
Roger,
Yes.
Ronald.
Yes.
Oh. Jessica? Oh,
Yes.
okay.
Right. Good job, guys. So we will move on to department reports. Our favorite one is the animal shelter. Cliff, you got for us.
Thank you. Good afternoon, Mr. Chairman, members of the board. Brief report. We're facing a couple of major challenges that we don't normally face. First one is there's a cat hoarding case going on in the city of Whitefish. And looks like there's over 100 cats that were in this house. So there's some, I'll spare you some of the details. The best part of this story is our friends, partners, the Flathead Spay Neuter Task Force did this once before back in about 2012 or so. They were set up to take 100 cats that we had to take control of that were found out in the West Valley. So they have a great crew of volunteers, and they have taken in more than 85 by now in trapping every day. And we've taken in probably a dozen, and we're trying to be ready for, for more. And we're going to help them get them adopted out. But we have been providing food, vaccines, and litter, and they've been providing the real hard work. And, so thank goodness for them, because we don't have room for 85 cats in our shelter without the ones that we already have. So that's been quite the challenge, but probably the biggest challenge is we have a staff of 8, and we have 3 open positions right now. And one of the remaining is out this week with a family emergency. And so we weren't getting really any applications. We had 2 applications. One wouldn't return my call, and the other could not be hired for various reasons. So thanks to a couple of the brightest minds in this department, obviously that doesn't include me, and some guidance from the Human Resources Department and some approval from the commissioners, a way was found to make the job more attractive to applicants while staying within our budget, while respecting the county employment matrix and living within the collective bargaining. So Jen and Kalia, not here, but they came up with the part of the idea. So already we've got, I think, 1 or 2, that was a couple of days ago at 5 o'clock, it was posted, and we've had a couple of applicants. So maybe we'll make it, but everybody's a little stressed in there. So, but the group, we have a great group. So again, thanks, Pam. I think that's probably enough. Okay, any questions? Thank you.
Okay, on the next item, community health.
Melanie is not here today, but Carrie Weaver is here and Jillian Wall are here if anybody has any questions about immunization. But Carrie Weaver, we were gonna do some
Good afternoon, everybody. So I'm Karen Weaver. I am a home visitor, the lead home visitor. I've been here for 5 years. So we have really good news to report in that we are finally fully staffed. And we have a great staff, so that's pretty exciting. We're very happy. Our newest home visitor is Kerrigan Wise, and she's a young gal and has great experience with kiddos, and she's finishing her parents teachers training right now, which is the program we do, and she's doing really great. She's going to be a rock star, so we're really excited. Last month, looking at just our stats, which are probably up there, 84% of our caseload were 84%, but given that we have a new member that's going to be filling up the caseload. So we actually, when they do their adjusted caseload from the state, we're at 96%. So we're doing fine there. Our maximum caseload is 77 with the budget cuts that we had a year and a half ago or so. We used to be in the 80s or 90s, now we're at 77. So we served 65 families in August. So we will get up there. The other great news is we don't have a wait list. When we were so short-staffed over this past year and a half, we had a long wait list at one point. And so it's really nice to be at 0. So we can serve families right away if they're engaged and want to be in the program. Referrals for August were lower. There were only 5. That's not unusual because it's just summertime kind of thing. And our biggest referral source is Child Protective Services, and they're very understaffed. So we met with them, our teams together, their staff and our staff in June, so they could meet our staff and we could meet theirs. But they're like at half of what they're supposed to be, and so they're probably a little bit behind. Sometimes I'll get a big stack in one day. In September, we generally get more referrals because Head Start is back in school, kids are back in school, teachers are seeing maybe some families that need some support. So we expect that to ramp up as well. We are also reaching out to Casey Driscoll, who is our homeless liaison with the school district and is in charge of the Heart Locker. And that may be a way to get some referral to for some of our families. So we'll continue to work on that. I'm going to try to go over to CPS. We're going to try something a little bit different to see if I can help them, since I'm the gatekeeper and do all of the referrals. Go over there and maybe twice a month at the tail end of their staff meeting, for example, and sit down and say, okay, who do you have to refer? Let's do it real quick, get her done. Here, I've got a referral you sent to me 2 weeks ago, but it's the wrong phone number. Do you have something else? Go that little bit of back and forth so that we can really get referrals moving quicker when they're so backed up, but still be able to serve families. So I'm happy to do that. So we're going to see if we can work something out. Lots of outreach to, again, CPS, Head Start, and Child Development Center. We have them come over and do an in-service for our staff. Things change all the time, especially since the pandemic of what your agency is doing. Things have changed. And then we got our first referral from them. I just about jumped out of my seat when I saw it. It was really great. We refer a ton to them, but they haven't always referred a lot to us. So that was really cool. So we do what we call group connection events, trying to connect families. It's one of our deliverables for our program, to have these at least 1 a month, 12 a year, which we did last year. So that was cool. We're back in person. We did an art in the park. We did an event called Plant a Seed, Start to Read, which was a kickoff to summer reading. That was super fun. And we did it in 3 locations at community gardens, and kind of tied in what a community garden is too. And then read a book about planting, and then the kids all planted flower. And then we handed out our summer reading books. So now we're going to reward them with some prizes for their summer reading. At the end of the month here, the end of September, we're going to do a collaboration with Imagine It Library and do a scavenger hunt in the library. So kids that haven't been to the library are going to learn where they are, and they'll get a prize. So try to make it super fun, but also to get them. We always are promoting literacy, so get them in the library. Our CQI over this year has been well child checks, and we're already over our benchmark, and we'll continue to work on that. Super important. What we found is that The missing appointments a lot of times coincided if there wasn't an immunization. So let's say if the 2.5 year is a well child check, but there's not an immunization due, then they tended to skip that one. So we've been providing education. We utilize Jill and the other nurses. If we have questions, we also have a nurse at home visiting, Amy. And so that's been really good. Families didn't realize I guess I should still go even though there's not a shot due that day. And I just wanted to read a couple of successes. So every month when I do my report for the state, I have all of our home visitors send to me some of their successes, and I think it's nice to hear a couple of those. For one of mine, I have a family that I've worked with since Mandy or somebody from family planning walked them down to my office almost 4 years ago. And they were a young couple, found out they were pregnant, and their eyes were that big. And they've been with me ever since, and they're doing so great. They've upgraded their home. They have both gotten better jobs. Their child's in a really great preschool, and she's just thriving, and the family's really doing well. And there was not a lot of support, especially from the dad's father. He is now the caretaker of a little girl. Like, it's just flipped. He's just in love with this little girl, and now he takes care of her when mom and dad are working. So it's pretty cool. Dawn reported, she's one of our other home visitors. She did an assessment here not too long ago that resulted in showing this child had some communication issues, did some referrals, got to the primary care doc, and then got some speech therapy and has seen some great strides. So that was one of her successes. Amy is exiting, as I am, a few, and Dawn, some kids, because they're going to kindergarten. And that's what we're supposed to do in this program, is get them ready for school. But several of them want to stay in the program, and they do have younger kids, so they're going to enroll. We have 3 of them stay, which is also a testament to the Parents as Teachers program and our home visitors. Challenges we're seeing is the same CPS is seeing. We talked about this. There's a lot of fentanyl, alcohol, and gun violence that we're seeing to a level we haven't seen before. They're making some referrals for some removals because of that. A week or so ago, I talked to Jen from CPS, and she said that in 1 week they had to remove from 5 families, and 3 were teenagers. 3 families that teenage, and that's unusual. So we're seeing that as well. So the referrals we are getting are up a notch from before COVID, as far as the high risk, more domestic violence, more of kind of everything. So when we get those referrals, and homeless, I should say as well, we have several families that are homeless. So they want our program. They think it would be helpful and know it would be supportive, but it's very difficult when there is so much going on in their family or they're homeless. Because Amy has one client that it's hard to find a time to meet with her because they're just trying to find a place to do it. So, challenges that we all see in our community, but that's one for us. We did a new brochure, so I wanted to have you each take one and look, and we're really proud of it. We really like it, and we've been busy getting that to all of our outreach agencies. We each we'll probably have 4 or 5 each on our sheet of agencies to keep in touch with so that they know about our program, they'll refer to our program, and then we learn about what's going on in their program. So we kind of check in with them at least once a month. So does anybody have any questions about home visiting that we can answer? All right, well, thank you so much. Appreciate your support.
Thank you. Thank you.
Sure. Hi, I'm Bill. I'm public health nurse downstairs and help supervise the immunization clinic. So as some of you guys know, we are offering the 5-valent vaccine that came out. So we offer these every Tuesday downstairs in our clinic for the community. Much point not only at this point, we did over 200 people just 2 days ago. which is great. And then we will continue to offer that every Tuesday. And then people as well, more places are offering it, like pharmacies or clinics, which is huge because you're down there, you don't want to. It's really nice for people who go elsewhere. And then we have our big annual big annual flu clinic coming up. in Charles. Clinic will be we also initiated some of, like I briefly touched on last week, or last week, 2 months ago. Feels like last week. The PCR and antigen travel tests, and we're starting to get more interest. A lot of people going on cruises, just getting to Canada. So we've been staying almost 20 last month, and seeing again, a way more affordable option than.
Is the demand for the updated COVID vaccine? I mean, are people, how far are they having the schedule? Are they having the
Yeah.
schedule ahead of time? or
We
is
have
it
online
walking?
scheduling available, which is great for meeting numbers, but then we also have staffing to help facilitate make those appointments. Right now, our schedule opens up all the way through October 11th, and pretty much fully booked already for this coming Tuesday, and then but we still have some appointments that they're filling out.
So about 2 weeks out.
Yes. Yeah. Very full. However, it seems like we're gonna run out of Moderna by next week. The state doesn't know when their next shipment will be, so there might be a couple of potentially a week to 2 weeks there where we only have Pfizer. So we're making sure that people know that when they're calling the schedule. And hopefully the state will get more shipment and we will as well.
Anybody else have questions for Bill? All right, thank you.
So the population health, when we have, Lisa's going to introduce our population health employees, and then we're going to have Jeremy here will talk about behavioral health after that.
Good afternoon. So like Ben said, I'm excited to announce that we are fully staffed within our people program. So I have front here, Jonathan Griffin. He's one of our people disease public health nurses. He was with us back in 2018, and unfortunately, we're lucky enough to have him come back. And then we have Taylor Hunt. She is working as the congregate care living prevention specialist for working with lots of care facilities and group homes and whatnot when it comes to infectious disease outbreaks in the facility. And then we have Macy Doty. She is our people abuse investigation specialist, focusing primarily on treatment of infection, smothering territory. Are there any questions on the people abuse report while we're here? We did have a put out a press release this afternoon that you guys might have received in regards to our first positive of the season, which is towards the end of the season. So the activities probably declined, but we wanted to make sure the folks were aware that we still, there was the potential of yourself or your pets being exposed to a rabbit.
Any rabies cases?
Yeah, a first positive fast, but in humans, no, or domestic animals. Yeah. One, yeah.
Could you address the mercury poisoning? I was just kind of wanting to see that
yeah.
pop up on the radar.
Yeah, that was a very interesting scenario. Interestingly enough, they're completely unrelated, the two cases there. The one situation was an individual that had a lot of exposure to consuming fish on a several week fishing trip. So that is probably the most likely source there. The other one, we're still investigating. There's some potential sources, but we're still working on that one. But completely unrelated, different demographics.
Where was the line?
Midwest, they did have some recreational, activities over in that area and did identify some ticks on them when they were there. Good question.
Reiterate, Montana has not had confirmed line presence within the state, clicks within the state. There are cases within the state of Montana have come from. I'd just like to clarify that there is some misunderstanding of that within.
Absolutely, yes. So thank you for the reiteration. It's something that we do like to let people know of as well. And so far, the entomologists have not identified the black wicked tick in Montana. So we've been to Thank you.
Thank you.
Jeremy wants to give you a behavioral health update.
Good afternoon, everybody. Thank you very much for allowing me to present an update on behavioral health. I'm the mental health and substance use collaboration specialist for the Platte City County Health Department, but I also do the crisis coordinator for Platte County. What that means is I facilitate the Platte County Behavioral Health Collaborative meetings, as well as in the crisis now model, which includes crisis facilities, crisis lines, which is our local crisis response team. So the collaborative, I'm going to talk a little bit about collaborative, how it came about is it came about from 4 of the charter organizations, which included Logan Health, Whitefish, Greater Valley Health Center, and then Platte City County Health Department, which comprises of the executive sessions of the executive collaborative. The a strategic plan is in place for the collaborative, which 2 primary goals that are striving for with this group includes the core leadership team of Platte County Behavioral Health Collaborative Stakeholders Group to implement the strategic plan and serve as accountable entity for behavioral health systems within Platte County. Goal number 2 is equitable access and coordination of quality behavioral health programs, services to meet the needs of all populations experiencing behavioral health crises. Those are 2 main goals of the strategic plan that is driving towards behind the Platte County Behavioral Health Collaborative. As I said before, we focus on the crisis now model, and they address any sort of gaps that are present in the community for the behavioral health continuum. Through this collaborative came the crisis assistance team, which is CAT, which is comprised of currently 1 co-responder and then 1 care coordinator. They were housed underneath Western, but have since transitioned to be housed underneath Greater Valley Health Center. We're in the works of hiring an additional co-responder as we speak. It's under the process. Once that's what that is they go out with law enforcement and they respond to anybody in the community where they're at if they're experiencing sort of crises. They've been highly successful with resolving a lot of these individuals within the community. The deferment then happens from the jail or from that's the crisis response model that we have by county. It is all underneath the County Tribal Matching Grant, which is now called the Crisis Diversion Grant. And so we're lucky to have such a dynamic team in the county. The other one is a suicide task force that came about during the Platte County collaborative meetings, and it is co-led right now with the Shoot Foundation, also with Logan Health Behavioral Health. It comprises of 3 different committees they have: prevention, intervention, and post-vention. I know they're working diligently with the community members to try and meet those needs, addressing that. The other thing is the collaborative receives updates from the behavioral health related coalitions or groups within the community. So as part of my job, I would say a lot of those collaboratives and coalition groups to do that to the 5 counties. Other work I do or other projects is one of our KIP goals is pilot project for the Education Center underneath the ESPER grant. And what that is a universal screening for students that we partner with the Health Institute and be able to provide the tool comprised of suicidality, depression, anxiety, resiliency, and substance use. We've already had a preliminary fall screening that happened, or spring screening that happened last year. This spring, we'll do all of the students screened. And it's an opt-out program that's being led by the schools. So, and we're hoping for measurements of success with that program, which would include students connected to resources, increased resiliency, increase in functional impairment scores. And the other committee members that sit on that one is Logan Health, Craig Valley's Health Center, and the Foxley County Health Department, Montana Healthcare Foundation. That's kind of a bit of a quick summary of the projects that are undergoing right now. It's ongoing with behavioral health. So dynamic changes in the community here, but questions. But in regards to behavioral health. Yes.
So when they go out and do intervention, do they have opportunity to touch and able to make an appointment with a healthcare professional, whether it be a psychologist or something?
Yeah, that's a great question. So at the time the co-responder goes out and meets with these individuals, they're predominantly de-escalating health crises. These individuals are experiencing at that point in time. There is a care coordinator that does a lot of the follow-up piece in the firm. Yeah, they are able to connect with some resources.
All right, thank you.
Thank you.
Move on to,
Good afternoon, everyone. I'm Mandy, manager at Family Planning. So we're really pleased to see that patient visit numbers are holding steady. This August, we saw a 15% increase in patient visits compared to last August. We're launching a new service I wanted to tell you guys about. So we're going to launch the service in October. We're going to start prescribing and dispensing PrEP on site at our family planning clinic. So for those of you guys who don't know, PrEP is a daily pill that reduces your risk of getting HIV by about 99% when taken as prescribed. Historically, there's been a lot of barriers for folks to access this medication. It can cost thousands of dollars to get it at a pharmacy. So because of our 340B program, family planning can get it at very low cost, and we're going to offer it for $30 a month. But folks who qualify for a sliding fee scale will get it less than that or pay nothing out of pocket at all. So we're going to start a pretty big campaign in October promoting that folks can come to our clinic, seek care with our healthcare professionals, and get this prescription in-house at family planning. So we're really excited to be able to offer that. On October 14th, we're going to host a community Narcan or naloxone training. We've had a lot of interest from the community members. People that have signed up have a really broad range of occupations and backgrounds. We've almost filled our first class. So if we continue with this type of interest, we plan on holding more trainings throughout the year to get people in our community to know how to respond to an overdose if needed. Our syringe exchange visit numbers are trending back to previous months. We've also implemented a new policy within our syringe exchange program to help increase return rate for our syringes. We started this policy in August and already increased our return rate by 15%, totaling about a 65% return rate. And our goal is to get about a 70-75 return rate from the folks enrolled in that program. We also are fully staffed and really excited about that. We recently hired Nate McLaws, who's right there. Nate's going to be working in our harm reduction program, facilitating our syringe exchange program. He comes from Boston. He worked in a syringe exchange program in Boston and has brought all of that knowledge here. And we're really lucky to have him on board. He's brought a lot of knowledge to our small town. So pretty exciting to have him. Any questions?
What policy difference what did you change to increase the return rate?
Yeah, so when they came on board, he wanted folks to have more buy-in, and we're doing more of a point per point. So folks have to bring in syringes, return syringes to get a certain number back. So we'll never have somebody leave without any. Is it 10? Will we give them a packet?
Yeah, so the way it works is that, person come in, and if they bring in 130 needles, other than 180 needles. The obvious intention is for people to have needles as a whole. And so if they don't have anything, it's taking 50 needles. So if they have something to use, but the idea is that they are kind of driving this program. And so educating them about the ability to bring back the needles and whatnot. And it's been very good. Like, I think in terms of the needles, there was over 6,000 needles dispensed in August. There were 4,000 needles returned. So there's already been.
Any other questions? Thanks so much.
Mosquito control. You all came here for. Good afternoon. Again, I'm Brock. I'm the mosquito tech for the program. So first off, we had Dave Nixon with us as a full-time mosquito tech now. He worked for us for the last 2 seasons as a temp. Dave's been just amazing for us in the program. Day one, when he walked in for the interview, I knew he'd be a good hire, and he's proven me right. So thanks, Dave. So as far as the season goes, we're very happy to see it dwindle down. The extreme heat and dry season that we've really gotten in the past couple months has driven the Culex, I guess the population of Culex that we've been finding. So that Culex season has progressed into September, which is a few weeks longer than normal. So up until this point, we're still finding a few hot spots. Statewide, Montana has 1 reported equine case, and that's in Lewis and Clark County. And then 2 positive mosquito samples out of Dawson and 1 out of Lewis and Clark County. So this season is actually pretty low on the West Nile cases. So that's a good thing. So the 2022 mosquito season, we had 4,385 inspections. Granted, and this is with 3 people. So 4,385 inspections, 890 treatments. We treated 1,330 acres. And our total number of sites now, I had put down 1,800. It's actually, I did a recount, and it's 1,402. So it's always changing. We're always getting rid of some sites that aren't produced or haven't produced in the last 2 years. And we're always adding more. So as far as this off season goes, Dave is going to be helping environmental health do final inspections. So he'll be helping them until February or January. And then I'll be busy just doing office stuff. And then we have a lot of sites that need cleanup this year from all the excessive runoff that we had. So I'll be busy doing that. And then the drone situation, still under investigation. I haven't heard any more about it. That took place on July 13th. So I'll let you guys know more on that. So, any questions?
So thanks, Brock.
Thanks.
Okay, move on to the environmental.
will be presenting for Jim today, because Jim's at a training.
Yeah, so environmental health, we are not a lot of new things to report. We're very busy as usual. Food inspections, you can see the numbers we've had, over 300 inspections of some kind, not food related. With that's four inspectors, so they're extremely busy. The public accommodations did seem to slow down on some of the inspection side a little bit. You can see that was keeping our food sanitarians fairly busy this summer, dealing with those through at home, which we all have known about. So I guess that's positive that they're able to put a little bit more in some directions. Let's see, they gave out 4 core scores in August. 4 C, I believe. I think it was Craggy Range and Whitefish, Little Charlie's, Asian Buffet, and Blacktail Grocery down there. I mean, I personally don't know much about them, but it's in the reports. They do have a goal, hopefully, moving forward, to try to get some more school inspections done on a regular basis. They do kitchens fairly regularly, but actually doing more school safety side of things. I think it's a very positive thing to shoot for on their side. On the septic and land side, we are getting closer to being fully staffed. We have Jake Rubel come over from the mosquito program. Just this past week, I believe the Montana Board of Sanitarians accepted the application, so we're now training, which is great because now we can start doing a lot of the work, take some pressure off the other sanitarians. He's going to learn very quickly. He obviously has a lot of knowledge already. So he's doing final inspections right now, and maybe some site reviews where we're reviewing what the state DEQ is giving us for septic. And he's learning quick and doing great. We have a new, Jim, he's been incredible asset already, and you're helping us out. As far as the septic activity, you can see application went down a little bit in June, July, but back up in August, 92 applications. We're about telling people we're about 8 to 10 weeks out to get out of some of those inspections. We just have to do the best we can, and we're trying to be as efficient as possible. But a lot of final inspections too. As we get, you can see the number wasn't as high, but that'll probably jump in the next couple of months as people start panicking for winter time. Get their septic to the ground. So. Subdivisions, still a lot of activity there. Wendy Jacobs works, tries to keep up with those. The DEQ isn't behind on all that subdivision stuff. It's mostly by the firm. So they're in a tough spot with staffing, and so Wendy does a good job doing the work that will last her way. I would like to highlight too on the food and consumer side, and they worked with Jen, I think, people on the other side as well. When Evergreen issued their precautionary boil order during that week, those folks in our office got on the phone right away and called all the facilities and checked them, make sure everyone knew, and those folks did. It was pretty impressive. They took a little extra time at the end of their day to just put it inside and launched into that. So I think that's worth noting. Things like that, everything stops. So that's mostly everything I have reported.
Seems like 3 of those food violations are kind of on the frequent flyer list.
Yeah. My understanding is, yeah, maybe
after a certain point. Infractions, do we do anything about that?
We do put them on a plan of compliance after certain score and not following through. They do have a checklist that they have to go through. So they have more frequent visits. They have to meet sanitarians more, that type of thing. So yes, they are on that.
Yeah, those 3, I've seen them on the list 3 times.
Yep, and Nickel Charlie's, we've tried to work with corporate. They're also the ones that own North Mountain, and we work with them, as we know, over the years, trying to get them back, and we continue to work with them, obviously. But we can look further into it. Looks like some of these are pretty recent. They're August 23rd, one was August 22nd, so we haven't had their revisit yet for a better score. So we can definitely find where they're at with the plan of compliance and try to re-educate. I think what the big thing is that with some of these is that they have that high turnover of the managers. And so you get a manager that's finally doing what you want them to do and how to do it, and then all of a sudden they leave. And then we're back to square one with them. And if it's not coming from the higher office. then it's harder.
Any other questions for Fred? Thanks, great job.
So Kirk is gone for finance. He did leave a couple notes that the health fund is in good shape starting this year. Always a good note. The mill levy calculation is at 3.9 mil for fiscal year 23. It's 1 mil lower than last year. And then the AC chiller has been delivered and awaiting install. I will say that Kirk, also with under finance, we have been working with home health and finishing up home health. And I was just going to talk about that, which the health officer report too. So I'll just kind of go in there. But we should be completely out of that building by October 15th is the goal. So we stopped services July 28th, 29th. But unfortunately, we still have to wait for billing to come in. We still are trying to dismantle the building. We're trying to work with finance and then also anybody else that we can to get rid of the extra offices stuff that's in there that needs to go away. We were able to donate quite a bit of stuff. Family Fighting was able to take some of their medical stuff, and we were able to donate quite a bit of stuff to the jail. So that the jail nurse came over and took quite a bit of stuff, which was good for wound care and things like that. So we were able to do that. But Kirk's been working pretty closely. We're going to have to get the server moved over to here because we have to keep that server going because billing is still coming in through that home health. So that was kind of the complication with home health is that they weren't on our county server. Years ago, for whatever reason, it was decided they would have their own server. So we've been working pretty closely with Matt Reynolds with IT to try to get that moved over so that we don't have any disruption in the bill and the collecting of the bills at the end. So Kirk's been working pretty closely with everybody with that. So as of October 15th, we'll be out of the building is the hope. I'll just look into the health officer stuff.
Area patients still receiving.
No, we quit services on July 28th. That was the last day we were able to assimilate either into the Logan Health care or find other services, or they just were done services. So they gave their patients about a month and a half, I think it was 2 months warning that I was doing, and then we're taking patients. So everybody that wanted a job has found a job that was involved with that program, so that was good. And we did retain the fiscal person for just a little bit longer, but it sounds like they'll have a job as well. Also, one more.
One quick question. Back in July, there was still 168,000 deficit in there. It's been almost 2 months. Is that
For home health?
Yeah.
We're probably going to have a deficit for home health. I think they originally the home health committee had thought that it would be a wash, that we would be able to come out pretty even. Kirk's hopeful that it's better than he had thought, that there may still be a deficit. But we're still collecting. So we could be collecting for another 3 months with how billing works, unfortunately, for money's coming in. So. Okay. Jeremy had touched on it, that the transition took place with the co-responder program. So we worked pretty closely with Great Valley to get that taken care of so we can move that over. I think the care coordinator and the co-responder are in a better place. I think they're getting the training and the support that they needed that they weren't able to get with the other organizations. So that is really encouraging because we were able to maintain that co-responder, because she actually had put in her resignation prior to us transitioning. So it was benefit for everybody involved. And like Jeremy said, they are interviewing another person. And so we would be able to full staff on that one. For the co-responder program. We do have a reaccreditation, virtual site visit. It's going to be held on September 22nd. So as you know, we're an accredited health department. And so every 4 years or every 5 years, we have to get reaccredited. And so Leah has been working tirelessly with that program, and so has everybody else, because she's been asking everybody for information for reaccreditation. So we will be sitting in on a virtual site visit is how they do it now, and it'll be probably about 4 or 5 hours that they'll basically be interviewing us through everything that we submitted to them. So that'll be September 22nd. In the past, for past board members, they were involved with the reaccreditation program, or they were involved with the accreditation where they interviewed board members. This time, they don't need to talk to board members. They're just looking at that we are maintaining what we had originally submitted 5 years ago. So that's going on. If you notice, our new website is up for Flathead County. So Flathead County transitioned to the new website. So Malia has been working out all of the kinks to get that going, but you can see it's a little more aesthetically pleasing and hopefully more user friendly. We're working out the quirks, making sure we're getting the online scheduling and other things so that it's working smoothly, but hopefully this will be a better format for everybody to be able to find our services. Lisa had touched on the rabies with that. We did have that one bat. We did send out that press release today, and it was kind of in conjunction also with the local veterinarians. They did want people to be reminded that, you know, bats are still out there and that their pets could be, you know, in jeopardy if they don't have them vaccinated, and it kind of helps with our whole rabies vaccination program as well. I did want to touch on, Artist brought up a good point, the difference between our SHARPS program. So Population Health has the SHARPS program and then the syringe exchange program. And I think this is a good reminder because some of you may not know. So for about 15, maybe even longer ago, years ago, solid waste was seeing a lot of syringes in their green boxes. And at that time, they allowed everybody to go through the green boxes. And I know a lot of people were very upset that they lost their garage sale, but it was for safety reasons. So we worked with the landfill, and it's a landfill project and it's a health department project together. And so the SHARPS program is that we go out to pharmacies around the valley and we give them these little SHARPS containers, little red boxes of SHARPS, and we give them to the pharmacies for them to give to their patients. And it might be diabetic patients or whatever they need their needles for, so that they have a safe place to be able to put their needles. So they put the needles in there and then they bring it back to the pharmacy. And then we go out twice a month and go and pick those up, and then we take them to the landfill, and the landfill safely disposes of them. So that's the SHARPS program. So we do that twice a month, and it's been a great program. I know the landfill's grateful, and I know people are grateful to have that. And then the syringe exchange is what Mandy had and Nate are working on with the harm reduction, where they work with intravenous drug users and for them to be able to have be able to get needles so that they are not spreading disease. And that's where the harm reduction comes in. So those are the two different programs when we talk about syringe exchange versus SHARPS. So I just wanted to clarify that. And then Jillian pointed out the October 5th food clinic, so come on down if you guys would like to help. We're always welcome to have triage or greeters at the front. You guys are welcome.
That's your reaccreditation.
It's the FAB, it's Public Health. Lily's gonna hurt me if I accreditation board, Public Health Accreditation Board. So it's a national organization with public health that comes in and does it. And so when it's a national standard is what it is across the country that they come in and do it.
Any other questions for Jim? Right, thank you. So the next item on our agenda is committee reports. Guess I have to give that one. Committee wants to get it out. All right, so basically now, Monday, I guess it was, we have two items. One was the Rikers variance that we've already discussed. And the other one was we got a report on our biosolids program, ARPA grant program that we're working on. The report was provided by Greg Caprera and Bill Buxton, HDR. And where we're at on that is we're in the process of acquiring parcel of land, 38 acres. And it's more than ample size for the treatment building and processing that would occur. It does abut Lakeside's land, one of their land treatment. So that's a benefit. Because we're kind of in this as partners with Lakeside. They're going to take the deep camp water off of it. And we had a subsequent meeting then on Tuesday with the county commissioners and the county administrator on how to proceed forward and will be filling in on this. The original closing date was going to be March 31st. We moved that up to January 15th. Yes, it didn't seem, it seemed like we could get the due diligence done within that time frame. We didn't want the potential sellers to consider other offers. So we want to move ahead with securing that land if we can. It's actually on, we had budgeted $4 million for land acquisition, and I think there's about $12,000 an acre, which equates to about $420,000. So, but then the flip side of that, we're going to do a lot of road paving. We're going to have to do a pipeline and other things that will go into that also. So we're moving ahead on that. A number of the due diligence items include an environmental assessment, a geotechnical investigation, a wetlands delineation, a water rights investigation. See what kind of alter survey. So anyway, that's moving ahead. Keep you posted if you go. Questions? With that, then I guess we are at the end of our meeting. Well, we'd like to thank all the new employees. Look forward to having you work with us. Glad you're on board. So, I guess I will answer any other comments or comment. All right. Well, thank you all for attending.